Chapter 21 covers human reproductive systems. Reproductive systems have several functions. Within the ovaries or testes of organisms, meiosis occurs producing haploid gametes, either eggs or sperm. In mammals, birds, and some other animals, fertilization, in other words the union of egg and sperm, occurs internally. This is not true for all animals. Many fish and amphibians, for example, have external fertilization. Internal fertilization increases the likelihood that egg and sperm will find each other. In most mammals, following fertilization, the zygote implants in the female's womb, where it develops until it's ready for birth. Ovaries and testes also produce sex hormones, like estrogen and testosterone, which direct the development of characteristics associated with maleness and femaleness. Let's look at male anatomy first. This diagram represents a longitudinal section through the center of a male body. Located high in the pelvic cavity is the bladder. It stores urine until it's eliminated from the body. The urethra carries the urine from the bladder out through the penis. The urethra also carries sperm out of the body. The penis contains a spongy tissue which can become engorged with blood, causing a man's erection. The testes are located in the scrotum. The testes must be held outside the body cavity so that they'll be cooler. The lower temperature is necessary for maximizing sperm production. After being produced in the testes, the sperm moves into the epididymis, where they mature and are stored. From the epididymis, sperm next enters the vas deferens. The vas deferens loops up and over the bladder. Along the vas deferens, behind the bladder, is a pair of glands called the seminal vesicles. The seminal vesicles add fructose and prostaglandins to the semen. The prostate is located immediately under the bladder. It surrounds the junction of the vas deferens and the urethra. The prostate often enlarges in older males. As it enlarges, it compresses the urethra and can make urination difficult. Under the prostate is a pair of bulbourethral glands. The bulbourethral produce a lubricating mucus. Let's now look at female anatomy. The bladder is located in the pelvic cavity. It's drained by the urethra. Females tend to have more bladder infections than males because they have a much shorter urethra, making it easier for bacteria to get into the bladder. In females, the urinary system is completely separate from the reproductive system. One ovary is shown in this diagram. Eggs are produced by the ovaries. Ovulation is the release of an egg from the surface of the ovary. Then the oviducts collect the egg when it's released and carry the eggs to the uterus. Normally, fertilization that results in a pregnancy occurs in the oviducts. The uterus is where the fertilized egg implants and the baby develops during pregnancy. The base of the uterus is called the cervix. The cervix opens into the vagina. Usually during sexual intercourse, the sperm is deposited on or near the cervix, and the sperm swim up through the cervix and the uterus and on into the oviducts. The clitoris is located in the same general position as the penis and contains some of the same spongy material. The opening to the vagina and the urethra are surrounded by a pair of lip-like labia. These graphs summarize the female reproductive cycle. Usually the cycle is 28 days in length. Day 1 begins with the endometrium lining the uterus beginning to slough off in preparation for it being replaced in preparation for a possible pregnancy. If the cycle is 28 days in length, ovulation occurs on day 14. This proliferative phase prior to ovulation can vary in length easily plus or minus a week, thus affecting the length of the cycle. Following ovulation, if a pregnancy does not occur, a new cycle typically begins 14 days later. Estrogen and progesterone are two important hormones that regulate the cycle. Both hormone levels in the blood start out low at the beginning of the cycle. Estrogen levels peak prior to ovulation, and progesterone peaks after ovulation. If a pregnancy occurs, estrogen and progesterone levels remain high. If a pregnancy does not occur, both hormones drop off at the end of the cycle, and this decrease triggers the beginning of a new cycle. Here's a summary of this cycle. A pregnancy is most likely to occur if intercourse occurs about 3 days prior to ovulation and through about 3 days following ovulation. This interval is the result of the length of the time the sperm can survive in the female reproductive tract, which is about 3 days, and the length of time it takes the egg to move down the oviduct, also approximately 3 days. Because the fertilized egg has to develop some before it's ready to implant on the endometrium, fertilization that produces a pregnancy usually occurs while the egg is still up in the oviduct. Let's now compare several birth control methods. It may not be the most popular with some people, but the only method that is 100% effective and 100% safe is abstinence, as in no sex. The symptothermal method can be effective, but only if the couple is motivated and realize its limitations. Just counting days cannot accurately determine when ovulation will occur, but there are easily detected symptoms associated with ovulation. A slight increase in a woman's waking body temperature is associated with ovulation. Women can also look for a change in the consistency of the cervical mucus. It becomes similar to egg white at ovulation. Some women also notice a pain or a sensation that alternates between the ovaries with each cycle. An increase in tenderness of the breast can also indicate ovulation. An important limitation of this method is that it does not allow the woman to know 3 days in advance when ovulation is going to occur. So some other birth control method must be used prior to and immediately following ovulation. This method can also be used to help increase the likelihood of getting pregnant if it's used to coordinate the timing of intercourse with that of ovulation. There are many different hormonal methods of birth control. They use various combinations of estrogen and/or progesterone-like hormones, which basically fool the woman's body into thinking it's already pregnant. Oral birth control pills are popular and effective. At higher doses, they can prevent ovulation, but lower doses are usually used to reduce the likelihood of harmful side effects, including stroke and some cancers. These lower dose pills are still effective in preventing implantation, but do not necessarily prevent fertilization. Newer pills can be used to reduce the number of cycles completely or stop them. Injections, implants, and the birth control patch attempt to better regulate hormone levels by circumventing the digestive system. However, they have not eliminated the potential side effects. RU-486, Plan B, and Previn are meant to be used in an emergency. The higher doses of hormones they contain make them unsuitable for regular use, as the risk of harmful side effects is higher. Barriers work by preventing the sperm from entering the upper regions of the female reproductive tract. Male and female condoms also provide some protection from sexually transmitted diseases. Diaphragms, cervical caps, and sponges can also be effective barriers to the sperm, but they don't provide protection from sexually transmitted diseases. All of these barriers require the use of a spermicide to be most effective. IUDs are inserted into the uterus where they irritate the endometrium and thus prevent implantation. Because ovulation and potentially fertilization are not prevented, some people have moral objections to the use of IUDs for birth control. Damage to the uterus and infections are potential harmful side effects. Mastectomies and tubal ligation both involve cutting and/or blocking these tubes, thus preventing eggs and sperm from ever coming together. Because the tubes are small, reversal of the procedures is difficult. Of the two procedures, vasectomies are the least invasive. A man removing himself before ejaculating is not an effective form of birth control. Trying to wash away the sperm after intercourse is also not effective. Sperm are usually deposited on or close to the cervix, and once up inside the uterus, they cannot be washed away. Sexually transmitted diseases are caused by two different groups of pathogens, viruses and bacteria. As a general statement, the viral infections are more problematic because we don't have effective cures for HIV, herpes, and warts. Bacterial STDs can often be easily cured, especially when diagnosed early. However, troubling antibiotic-resistant forms are becoming more common. This ends the material for Chapter 21.